Good afternoon, KIPI listeners. This is Missouri Breaks doing our monthly show where we focus on a variety of public health topics. This week, our show is focusing on our FIPA study, which stands for Factors Influencing Pediatric Asthma. I'm Ray O'Leary, and I'm joined by Dr. Lyle Best.
My name is Lyle Best. I'm a family physician. I grew up in North Dakota and worked at the Indian Health Service in Belcourt for a little over 20 years. And then I continued to work part time in the local clinic and also teach at the tribal college in Belcourt. And that's how I got involved with research with Missouri Breaks.
That's great. So you're no stranger to Indian Health Service and Native populations, health, all of that.
Yeah, I came to Belcourt in 1977, and been going back and forth. I still go there once a month for a couple of days to monitor the research program at Turtle Mountain Community College.
That's great. So I guess back to the FIPA asthma study. Let's kick off by discussing why we did a study on asthma in children. Can you share a little bit about what you were looking for and why you chose this study population?
Right. So actually, it kind of started with you, Ray. Um,
Mhm.
I became aware that there was a grant having to do primarily with American Indian populations, the Center for Research in American Indian Health. And they were looking for sub studies. And I knew that you had done some work with Dr. Wallace, a pulmonologist in, I believe, Sioux Falls,
Yeah,
and developed some.
I'm glad you brought Dr.
Sure.
Wallace up because a lot of kids and adults, even with asthma in this community, know Dr. Wallace well. I believe he still goes to Rapid City for asthma clinic a couple times a month and maybe some other locations as well. So that should be a pretty familiar name if you're someone out there that has asthma.
Right. And I know you and Dr. Wallace had worked on an educational program, thinking that perhaps additional education for specifically how to handle your asthma could reduce the number of times that children end up in the emergency room or even in the hospital. And that was done in a certain way that gave you some encouraging results. But in order to really convince doctors and other scientists around the world, it's better to do what's called a randomized controlled trial. And I suggested perhaps that doing this kind of trial in the Cheyenne River area would be useful and help perhaps nail down and confirm your earlier findings.
Yeah, absolutely. And to kind of build on that, so the original study that we jumped off from was called Breathe. And we just did some asthma education basically with people in the community and a little bit of case management to try to help make sure that they had access to the medications that they needed and know how to use the medications. Because with asthma, a lot of those inhalers are very tricky to use correctly. And there's a real technique that can go into getting the most out of them. So we did just a lot of the face-to-face education on avoiding triggers and the medications, like I mentioned. So because we saw those promising signs that maybe that was something that could be effective, we, like you said, jumped into this randomized control trial where some people got the intervention, the breathe intervention with the education component, and then other kids with asthma didn't get it until the very end. And in that part, I'll just kind of spoiler alert, we didn't actually see what we had hoped to find to see reduced emergency room visits that sustained over time. It did look like there was maybe a little bit of an initial improvement in the people that got the education, which to me I think is a testament to the need for ongoing care. That we can't just do this flash in the pan one time education and expect people to comply with everything they learned forever. But maybe there's need for ongoing care like that. And of course, while we have asthma, kids with asthma in the building, let's also see what influences asthma. So can we talk a little bit about the findings that other findings, I guess, from the FIPA-1 pediatric asthma study?
Right. Yeah. The part about the trial was focused just on those children with asthma, but in order to understand better what might be causing asthma, we really need to compare children with asthma and those without. And so that's what we did in terms of what's called a case control study, where we had about 104 children with asthma, and we paired them up with two children without asthma for each one that had that condition. And then we checked lots of different things in their environment to see whether there was something that might be stimulating the asthma symptoms that they had. We were interested in whether or not there might be a genetic component to this. Maybe there were genetic changes that they'd inherited from their parents who increased their risk for asthma, or maybe increased their protective ability against asthma. And so those were things that we did in what we call the case control study, and that I think was useful. What we found basically was that many of the risk factors for asthma in the general population and non-Indian population were very similar in what we found in Cheyenne River. There are certain people with asthma that have atopy. They have kind of a hyperactive immune system that kind of gets them stimulated against lots of things that many people aren't really stimulated by as far as their immune response. And so we found that the children with asthma had increased responses to certain molds, for example, in the environment, certain insects, cat dander, and things like that. That wasn't too surprising. Again, that's something we see in the non-Indian population as well. We did collect DNA from the children, and we looked to see whether some of the genetic changes that have been reported in the non-Indian population are the are show the same effect. And we did see that in two different areas and two different chromosomes, where differences in the genetic makeup, the spelling of the genetic code in those areas was a little bit different in those children with asthma as opposed to or compared to those children without. And so that was another finding that we uh, developed from that case control study.
Hey, thanks. When I back when I was doing the breathe asthma education, a lot of people would ask, where does asthma come from? Why did I get it, or why did my kid get it? And one a mentor of mine back when I worked at Stanford and Sioux Falls explained it in a way that still stuck with me. That asthma is kind of like a light switch that. Some people are born with that light switch and some people aren't. And really, that's just an analogy for genetics that there's some people that, have blue eyes and others that have brown. So it's just like that. Either you're born with that asthma light switch or you're not. But it takes something in your environment to really trigger it and turn that light switch on and make you into a person that has asthma. Um, so I think that that's something that always seemed to make sense to people that, okay, yep, I got the asthma gene, but it was something in my environment. Maybe I was around secondhand smoke as a kid in the home. Maybe there were, a lot of dust or ranch life and animals that, like you were talking about the atopic asthma and kind of those allergy triggers that can really make the asthma turn on and get worse. One thing that we found in our population with this study, the FIPA study, was that there was a high disease burden, which is just a fancy way of saying that if you have asthma, it's kind of hard to control, and that we found almost half of the kids that had asthma were poorly controlled with their symptoms. And I think that oftentimes people are afraid to take certain medicines or they just don't like it. I've been guilty of being prescribed something and then deciding like, yeah, I just didn't care for that anymore. But I think one thing that I believe isn't prescribed often enough or maybe taken often enough is inhaled steroids. The guidance, I believe, if they haven't changed recently, used to be that if you have to use your rescue inhaler or like a albuterol nebulizer, something like that, more than 2 to 3 instances in a week, that you should probably be using a steroid inhaler to prevent those asthma attacks from coming on. And I think that that a lot of people just don't know that, or that there's a difference between the different types of inhalers they've been prescribed. So that's one big thing I always like to share with people that are struggling to manage their asthma, that maybe you just need that other type of inhaler to help with the swelling in your lungs and give you a better baseline for when you do come in with those triggers, your body can not respond so severely.
That's a really good point, Ray, and I'd like to kind of expand on that and go back a little bit more to the beginning where you were talking about what causes asthma.
Hmm.
And I think when you mentioned you have the gene for asthma, I think we have certain genes that make it more likely. But I think essentially anybody, if I was to have stimulate your lungs, I was have you breathe something that's really obnoxious, let's say ammonia, for example, you could get the muscles in your lungs to tighten up. They go into bronchospasm, and that's really what's generating the asthma symptoms that you have. And virtually anyone will respond if you have a nasty enough exposure like that. But some people are more sensitive in that way than others, and so what might bother you doesn't bother me when I breathe it in. And someone mentioned a while back that your immune system is sort of like a dog. You have a dog in your house. It's kind of a guard dog, but some dogs are just really obnoxious. They bark all the time, no matter who comes. They're constantly annoying. They're not just barking when someone is trying to rob you. Sometimes they might even bite somebody that comes that you don't, it's a friend of yours. So if your immune system is one of these dogs that's overactive like that, that's what gets you into trouble with asthma. So you react in that way. And the steroids that you mentioned, the steroids are a general type of medicine that helps kind of suppress the immune system a little bit. So if your dog is kind of hyperactive, it kind of tranquilizes them a little bit, so he's not quite so obnoxious. I think that's the reason for taking those longer term medications like the inhaled steroids.
Yeah, as you say that, I'm remembering another bit of information I used to share that would get people's attention, and that's that, you know, most people that have asthma have probably been prescribed oral steroids or prednisone at some point, or you've maybe even gotten a shot of a steroid in the ER when they have an asthma attack. And those really feel crummy to be on. They can make you really hungry. They can affect your sleep. They can give you, mood swings. You just don't feel great when you're taking those oral steroids. So I used to explain that, if you don't like the way that you feel when you have to take the oral prednisone or steroids for your asthma attacks, giving your body a tiny bit of steroid directly into your lungs is going to be a lot better in the long run than having to have that big dose of steroid that doesn't really know where it needs to go. So it goes everywhere in your body. And that's why you get some of those side effects. So if you're somebody out there that's listening and just kind of frustrated with, managing asthma, maybe talk to your doctor about starting an inhaled steroid. That's a good fit for you. Any other factors influencing children's asthma that you can think of you'd like to share, Lyle, before we move on?
Well, yeah, I think one other point is that we're learning more and more now that inflammation, of course, is good for you in many ways. It protects you against all kinds of disease and so on. But it can be overdone, and not just in terms of giving you bronchospasm, so you develop asthma, but it seems to also cause problems with heart disease and so on. And the other thing we've learned is that having too much inflammation on a regular basis over a long period of time is not good for you. And the other thing we seem to be learning is that being overweight increases your general level of inflammation. We really don't understand very very well why that is, but I think it's another excellent reason to be really sure that you try and control your weight and stay within a normal range of weight. And we did see that in our study. Those children with asthma were heavier and more likely to be overweight than the children without asthma. So, I think an important lesson that came from this. And this is not just for American Indian children. This is seen in other parts of the world as well.
Yeah, that's a great reminder. I'm also remembering some of the other household factors that we learned about connections between the kids with asthma, and one of them was multi-unit dwellings, which is a fancy name for apartments. If you live in a duplex, a quad, an apartment that has multiple um, families under the same roof, that you're twice as likely, 2.3 times as likely to have asthma. And we also found that um, things like insect infestations, cockroaches, rodents, mice, problems like that in the home can also be connected to kids with asthma. And the reason for that is sometimes they're droppings or even like a cockroach after it dies and falls apart. You think about all the little parts of the leg and the wing and the parts of the body that can be affecting the air quality in the home and can also trigger asthma problems. So those were two of the household factors that we learned. And for anyone that's just joining, just a reminder, this is the Missouri Breaks Public Health Variety Show. I'm Ray O'Leary. I'm joined by Dr. Lyle Best, and we're sharing a bit about the factors influencing pediatric asthma studies that we're doing. So with that, let's maybe move forward to the new FIPA, which is FIPA 2, that's currently ongoing at Missouri Breaks. And I think it's quite a clever name, Factors Influencing Pediatric Asthma into Adulthood, because now some of these kids that joined the FIPA study several years ago have become adults, and we're trying to make contact with them to bring them back and see what their health is like and what we can learn from them. So Lyle, would you like to describe kind of where we're going with this new round of FIPA and why it was important?
Right. Yeah, as you mentioned, we're interested in following up the individuals that we were in the first FIPA study. And, people change over time. As you become an adult, your body is different than it was as a child. And there are a fair number of people that may have trouble with asthma as children, and they grow out of it. And there are also people who don't have any trouble with asthma as a child, and they develop problems with asthma as an adult. So the adults we're interested in, of course, from the first study are still very young adults, but we're still interested to see how life has turned out for them so far and to do some follow up studies. We're also interested in a different environment. So obviously, the first study at Cheyenne River was a rural, more typical American Indian environment, I guess. But we have lots and lots of American Indian people that live in larger cities such as Rapid City, and so we wanted to see if there were any considerable differences between those that live in Rapid City and those that live out at Eagle Butte. So that's another part of it. Another part is we've learned that what are called adverse childhood experiences can increase the risk of many different health conditions. And so we brought a new scientist into our group, Dr. Thakur, and she has been helping us. She's done some questionnaire work in the California area, and we're bringing that into our study as well to see if these kinds of adverse childhood experiences, the loss of a loved one, for example, some other dramatic cases like that can be fairly common, unfortunately, in American Indian communities. So we want to see what kind of influences those would have. We also discovered towards the end of our first study, there's a particular virus, respiratory syncytial virus, RSV, that is really very common. Almost everybody gets it at some point. But if it's acquired at a fairly early age in a fairly severe case, it seems like it sets up the individual to go on to develop asthma or to experience asthma in the later childhood years. And so we some of the blood studies some of the blood samples that we collected showed increased titers or levels of these antibodies at a particular season. And so we're looking through that. The last thing I'll mention is some of the potential toxic elements in our environment. Certain chemicals like PFAS you might have heard about. Some of these seem to be more common in certain areas. We're testing for these as well to see if there's anything in terms of air pollution and so on that might be affecting health in regards to asthma.
Yeah, great. So for anyone out there listening who thinks like, oh, this kind of interesting. We are currently recruiting for the FIPA asthma study. And as we mentioned, we're both trying to make contact with kids who enrolled in the original FIPA study. What was it, 5 to 8 years ago, maybe, who are now adults, and also bring in a new batch of kids, both on the Cheyenne River Reservation and in the Rapid City area. And we're looking for especially kids that have asthma that are between the ages of 6 and 17. so we can continue all this research and answer these interesting research questions. And the ultimate goal is to learn enough about asthma that we can come up with some preventative measures that can be done in the community, whether that's more education or changing policies, for instance. I think about the school setting where I'm a mom of four. My kids spend probably almost as much time in the school as they do at home in an average week. And, all of the, potential harsh chemicals or, things that they can be exposed to everywhere they go in life, that are there, policy or system changes that can be made to help prevent and protect our young population from going on to develop asthma. So if you're somebody that's interested in this research, give us a call at Missouri Breaks. You can reach us at 605 and you can ask for anyone on the FIPA asthma study. And we can ask you some questions, find out if you're eligible. And if you do remember coming to our building in the past as a kid and talking about asthma, give us a jingle too. We might be on our list to bring back in for this study. And as you know what to expect on that, it is kind of a detailed process, but it's a one and done deal. It's not anything that is ongoing. But if you're a parent that's maybe interested in bringing your kid in, what you can expect is a consent process. We take it really seriously that we want both the child and the parent to feel comfortable with what they're signing up for. So we have to get a signature from both saying that, yep, I understand what I'm doing, and I definitely want to go ahead with this. And we also will then go into our lab. We'll do a blood sample, a urine sample, saliva sample, and a nose swab. And after that, then we usually will get a survey out, and it just kind of goes through some questions about yourself and your health and your home and other factors, how well controlled the asthma is. And we also do a pheno test, which is measuring swelling in the lungs. And a lot of especially the people that have asthma that come in for this study, get really interested in that piece because they want to know, like, how are my lungs today? Do I have any swelling in them? So that's been interesting, and we can give those results back right away. And it's important to or explain to kids, especially, that by participating in research, a lot of times they're not going to get direct benefit from this, but they can help, future kids. If we can learn more about what causes asthma and what makes it worse and how to make it better, then, future generations hopefully will have less problems with asthma. Um, so yeah, I guess, Lyle, is there anything you're especially interested about from the FIPA-2 study to dig into the data and see what it shows?
Well, I think it will be interesting to see what turns out, both in terms of the immune response to this RSV virus, and also in terms of the adverse childhood events. It will be quite interested to see if some of this has been seen again in other non-Indian populations. So in some ways, it kind of confirms what we might say we know already. Sometimes people, I think, are disappointed by that. Like, well, gosh, you just found the same things you find everywhere else. Nothing new. And I think some people have the idea of, well, we can uncover this golden nugget, and that will somehow cure asthma or cure heart disease in Indian people, but it wasn't discovered anywhere else. That would be nice, but generally speaking, I think knowing that the biology that you have in the American Indian communities is very similar to that in other communities, and therefore the medications, what we know about the disease process, how to prevent it, and so on, should work for you as well as anybody else. And so I think that's the good news.
Yeah, absolutely. I think I'm most excited, as anyone that knows me out there knows, I'm pretty passionate about smoking and or not smoking, I guess, or vaping. And I'm really curious because, the first time around when we did this study, vaping wasn't much of a thing, but it is now, especially in the young and adult population that we're working with for this study. So I'm really curious to see how vaping and smoking, or even exposure to that, being around someone else vaping or smoking, what kind of impact that will make on the change in status of asthma over time, or if we're seeing, less exposure than we did the first time around, because initially we saw pretty high rates of kids that were exposed to nicotine. So I think that's what I'm most excited about from the study. But
I'd like to just make maybe one kind of closing comment. We're looking at things like genetics and so on, and of course, you can't change the genes that you inherited from your parents. And sometimes, there's other things that are occurring in your life that you don't have much control over. But I think what we found in terms of the effects of being overweight for your children is really important, and that is something that you can affect. If you're a parent, you can try to guide your children towards a healthier diet. Try to monitor what they're eating. Don't just send them off to eat anything they find at the local store. You can also encourage them to get outside, gets lots of exercise, and you can definitely discourage them from polluting their lungs with various chemicals in terms of smoke and vaping and so on. And so I think those are the things you can really grab a hold of. You can do it yourself, or you can help your children to do it for themselves. And that's what I would encourage you to really work hard on.
Yeah, those are some great tips to leave people with, that we can't control our genetics, but there's all kinds of things we can control that can help reduce children's risk for asthma. So, for anybody that might have missed the beginning of the broadcast, this is Missouri Breaks during our public health variety show. And I'm Ray O'Leary, joined by Dr. Lyle Best, and we've been talking about our Factors Influencing Pediatric Asthma studies that we have going on here at Missouri Breaks. We kind of recapped what we found from the first round of the study, which is that, as Lyle said, genetics, housing environment, social status, immune system, allergies, all of those things do affect asthma in our community. We talked about the new FIPA 2 study that we're recruiting for currently at Missouri Breaks, and hoping that any kids out there that participated in that when they were young, as well as kids right now that have asthma between the ages of 6 and 17, will give us a visit, stop by our Missouri Breaks office on Willow Street, or give us a call at 964-1260, so we can tell you a little bit more about the study and what to expect. And yeah, just some final words of wisdom from Dr. Best, to not be discouraged if you got that asthma gene, that born with that light switch, but do what you can to monitor weight, avoid those triggers like smoking, and do what you can to keep your housing triggers reduced for the kids. So
Oh, I would mention, if you're really interested in listening a little bit more, you do have that YouTube recording, the Red Talk that we did a couple years ago. If they could go to the website, I think at Missouri Breaks, and pull that up if they wanted to listen to that.
yeah, great point. And we try to post on Facebook a variety of health topics. So follow us, Missouri Breaks page on Facebook, and you'll probably see some new findings coming out as this study progresses. All right. Well, thank you, Dr. Best, for joining us, and have a great day, everyone.